Hi, my name is Avery. I'll be your nurse today. What brings you in?
Well, lately I've just been very sore. My joints are swollen, and it's really affecting my everyday life. I find it gets better when I wake up in the morning and start moving around, but it's really hard for me to go about my day.
Oh, okay. So we're kind of expecting that it's rheumatoid arthritis. It's 3 times more prevalent in women 25 to 50. I'm just going to go talk to the doctor so that he can come here and give you more understanding of it. Is that okay?
Yeah.
Okay.
Here's a picture of a normal joint. As you can see, the synovial membrane is intact and there are no deformities present. And below it is a picture of a joint that is affected by rheumatoid arthritis. It is an inflammatory disease and also an autoimmune disease, which is where the body's immune system becomes confused and attacks itself. And as you can see here in this diagram, the lining of the synovial membrane is red and inflamed, and you can see a bit of the bone degeneration. We are unsure of the exact cause of rheumatoid arthritis, but we do know that it may influence the HLA-DR4 gene that is in the MHC protein in the cell membrane of B cells. Genetic predisposition is believed to be a factor. It is also thought that rheumatoid arthritis could be caused by a bacterial or viral infection. It is thought to be more common in people who smoke. Therefore, it may be influenced by individual lifestyle. Because it is more prevalent in women, it is also thought that estrogen could play a part in the cause of rheumatoid arthritis. The target is the tissue lining of the joints and sometimes the body's internal organs. This causes swelling, pain, inflammation, and joint destruction, which we did see in the diagram of rheumatoid arthritis. It has been suggested that the disease is initiated by the activation of helper T cells, antibody formation, and the release of cytokines. A common one involved is tissue necrosis factor, TNF. MHC2 markers on the surface of antigen-presenting cells, like B cells, are supposed to present foreign antigens to T cells, but in RA, it is thought that B cells produce autoantibodies, otherwise known as the rheumatoid factors. About 70 to 80% of people with rheumatoid arthritis have a high level of rheumatoid factor in the blood, which are proteins produced by the immune system that attack healthy tissue in the body. The rheumatoid factor is a self-produced antibody which is produced by confused B cells that react with a fragment of immunoglobulin G, or IgG, to form an immune complex. As you can see here, they're joining to form that complex. These immune complexes are found in the synovium, synovial fluid, and the extracellular lesions of people with rheumatoid arthritis. At the cellular level, neutrophils, macrophages, and lymphocytes, which are all white blood cells, are attracted to the area by cytokines. The neutrophils and macrophages phagocytize the immune complexes and release enzymes capable of causing destructive changes in the joint cartilage. The inflammatory response that follows attracts additional inflammatory cells, setting into motion a chain of events that perpetuates the condition. Vasodilation and increased blood flow causes warmth and redness. The joint swelling that occurs is the result of increased capillary permeability that accompanies the inflammatory process. Characteristics of rheumatoid arthritis are the development of extensive network of new blood vessels in the synovial membrane that contributes to the advancement of rheumatoid synoviitis.
So do you have a good grasp on rheumatoid arthritis now?
Yeah, I do. Thank you.
Okay, great. So I'm just going to discuss with you some treatment options. So some treatment options would be an increased intake of activated vitamin D and omega-3, and there are also some other pharmacological methods that you can use that you could discuss with your doctor if you would like. Do you have any other questions?
No, I think I'm good. Thank you.
Okay, you're welcome.
To summarize the 3 key concepts, there is a disruption of homeostasis because it is disrupting the synovial membrane. There is swelling, which causes pain and damage to the components of the joint, which could eventually become systemic and affect other organs like the heart. In normal homeostasis, this process would never happen, and the body's internal environment would remain stable and the body would not attack itself.
Proteins like the MHC2 marker are embedded in the cell membrane of the B cells that are supposed to identify foreign antigens, but in rheumatoid arthritis, they identify as foreign. Cytokines are also proteins that provide cell-to-cell communication and help with migrations of white blood cells into the synovial joint.